On the Newsfeed PM, the World Health Organization's member countries have agreed on a draft pandemic treaty that sets guidelines for how international communities might face the next global health crisis. Negotiations have concluded and the treaty is expected to be adopted next month at the WHO's annual meeting in Geneva. To discuss this further, we're joined now by Orthopaedic Surgeon Dr. Uyilawa Okhuaihesuyi. Doc, good to have you, and thank you very much for coming on this afternoon. What are the member countries saying they are now going to behave like should we, of course, have a pandemic similar to the one that we saw 5 years ago?
Thank you very much, Dr. Uyilawa Okhuaihesuyi. Thank you for having me. The pandemic in 2020, 2021 was something that really hit the health sector and the world in general. And it has been something that exposed the attitude of present world leaders in terms of taking the health as a priority very seriously. And I think the WHO treaty that is going to be signed in May is a welcome development because it will help in trying to prevent such pandemic that caused a lot of mortalities and heavy economic burdens, and also find way help us in ways of preventing such pandemic from happening again. And it also helps us to check the preparedness of such nations to such things if it does occur again, which I think is a way of really showing their preparedness, which is a good one. And I hope it comes to pass next month in Geneva.
In a world that is largely growing more and more apart, I mean, thanks to tariff wars and other restrictions that are being put on and domestic policies and so on and so forth that are happening, for example, in the United States and having an impact on other countries. How do you see that collaboration? Is there still room in that divide for countries to work together in coming up with solutions?
Yeah, I think at this stage in time, it's important that the world take the health of individuals in the individual countries most seriously. And thank God for the treaties, the intervention of then WHO in 2021 in trying to prepare nations towards such developments. As it affects the African continent and other nations generally, I think even with the divide, it still tells you that everybody needs to take the health as a priority in terms of one, trying to get border surveillance in trying to prevent infections, trying to prevent such pandemic that normally spreads from one continent to the other, and also in helping to share informations that are present in any nations and putting every person on alert when you see something that is developing in any country, and alerting other people that, yes, there's something that is going to be of a global concern, and we need to be prepared to handle such things. So I think it's a step in the right direction. And it also helps in strengthening regional institutions, which helps, like in Africa, that it tells us that we need to stand up and be able to provide the health for our own communities and ourselves. There's nothing wrong with us providing places where we can develop our vaccines in Africa, which is one thing I want to be as a challenge to us in trying to find ways of where we can cope such pandemic and help develop our own health system in our nation in general.
Yeah. President Donald Trump, once again, would have ordered his country not to participate in the WHO processes and in the formation of this treaty. So, by and large, they are not going to be signatories to this. Do you think that will have any impact, I suppose, considering, of course, that a large part of the research that would have come up with vaccines during the pandemic would have come from the United States?
The United States have been one of the people that have supported the WHO and the health generally in all over the world. And I know they are still supporting them in various ways. But this just tends to want to make other countries and other continents to also wake up to their priorities, because one country financing most of the health institutions generally doesn't make it right. We need to stand up for our own selves. We have to improve on our budget, that we budget for our health system. Like my country, Nigeria, you know that the budget for the health sector is less than 1%, which cannot help you in developing the health sector. In most of the African countries, you can actually tell that how many places in the world, in Africa generally, have places where you can provide vaccines, where you can have universal health coverage. Those are the questions we need to answer. It's not about the United States. United States, as on theirs, are providing for their own citizens and other people that are close to them. I think it's high time other nations wake up to such responsibilities in trying to provide best health practices in their own country and in the world in general.
Yeah. There are, of course, countries who are raising concerns that in case of international law, there are very few consequences for countries that do not comply. For example, during that time of the pandemic, when there was a great call from Africa to say, share vaccines, right? Some countries were hogging those vaccines, giving others to countries closer to them. And when they do share, for example, with African countries, in some instances, we were getting reports that we were getting a product that was close to expiry. What can be done to at least enforce this and make sure that countries do comply?
Yes, that's why one of the purpose of the treaty is trying to help share information between the nations in general. But I know in African countries have one of the best doctors in the world, and they have one of the best knowledgeable people everywhere in the world. And I think it's high time Africa as a continent on its own tends to bring these best brains together, because we can achieve more, not just depending on the WHO, also we can develop an African part of it that tends to produce such things. There's nothing wrong with South Africa, Nigeria, all the big weights of Africa going to build a place where all those vaccines can be produced, can be tested, can be verified. These are what our leaders need to work towards to. Let's try to build things that could help the African continent and the world in general. And let's be the pacemakers of all this to work well.
Doc, appreciate your time. Thanks for coming on. Orthopedic surgeon there, Dr. Uyilawa Okhuaihesuyi, giving us his perspective on the treaty that has been signed. Let's look for